Good evening, members of our City Council and esteemed members of our community. I want to thank you for giving me the opportunity to meet with you today to discuss a critical aspect of our community's safety and well-being, and that is community risk reduction. My name is Peter Marrero, and I work here at Iona McGregor Fire District. And community risk reduction is a very proactive approach, and it's aimed at assessing and mitigating risk within our community. It enhances our operational growth, our ability to have more operational efficiency, and by addressing the potential hazards in our community before they escalate, we can significantly improve emergency service delivery. We can save lives and we can protect property. So the way we've established the identifying of the risks for our community risk assessment is using various types of data, including demographic information, incident history, such as call history, and community health statistics. So this data provides very valuable insights into our unique challenges or vulnerability within our community. And one significant risk that our community faces is the lack of CPR training. Our department does have a CPR program that we use in-house, but there is still a need in our community for more active CPR training to the community, because due to the demographic of our residents, particularly our elderly and active demographic, we have roughly a population of 80,000 in our district that we serve, which swells to over 100,000 during season. And because of that influx of what we call winter traffic, we get an influx of elderly population, and in our active communities we're seeing an increase in cardiac arrest, and CPR would be very critical. Advanced, early care and CPR would be very effective in us providing care to those that go into cardiac arrest in our community. The impact of this risk in our on emergency service delivery is profound. Of course, we all know that every minute we delay in cardiac emergencies, when we delay intervention, it can lead to increased mortality rates or prolonged hospitalizations, and reduced quality of life for the survivors. And it also strains the emergency response resources. As we know, when we get a call for cardiac arrest, we have several units, including law enforcement, fire department personnel, emergency management, like ALS and ambulances that have to respond, and it taxes our healthcare system. So we want to propose to increase the amount of CPR training that we're doing in our community, and to address the risk, we propose implementing a comprehensive community risk reduction focused on CPR educating and training. So our mitigation strategies include partnering with local healthcare providers and community organizations to offer CPR certification classes, establishing public awareness campaigns to promote the importance of CPR training in our schools and in our community, and also providing initiatives such as discounted or free CPR courses and CPR training. So the cost of addressing this risk, while these strategies incurs a little bit of a cost, we're here today to apply for a grant or to propose a grant for this initiative. And while it does incur a cost, what we're getting in our community for the cost, and reduced mortality rates, shorter response times, and overall improved survival rates, I think it's worth its money. And then the empowerment of our residents with life-saving skills and being able to affect the community. It also fosters a culture of safety and preparedness. So I just would urge your support for our grant application to fund this community risk reduction initiative. By investing in CPR and training, we not only save lives, but we strengthen our community and we respond effectively to all these calls. And together we can prioritize community risk reduction for a safer, healthier Fort Myers. I want to thank you for your time and consideration on this grant. Thank you.